Hello, and welcome to the County Health Rankings and Roadmaps 101 webinar with a tour of our updated website. My name is Karen Odegaard, and I am a community coach with the County Health Rankings and Roadmaps. My colleague Jan O'Neill is also here, and she will be helping to answer your questions at the end of today's webinar, as well as sending some links out via the chat box throughout today's webinar. And you should now be seeing a link for slides for today's webinar, which are available online. The County Health Rankings and Roadmaps is a collaboration between the Robert Wood Johnson Foundation and us here at the University of Wisconsin Population Health Institute. This program is the result of the contributions of many partners, including those that you see listed here. We want to take a moment to get you oriented to the technology we're using today. The Gotowebinar attendee interface is made up of two parts. On the left, you can see the viewer window, where you will see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we will be taking questions via the control panel. Please feel free to enter your questions in that control panel at any time, and we'll answer your questions toward the end of the webinar. So here's a quick look at what we're going to be talking about today. We'll start with an overview of the County Health Rankings and Roadmaps program. Then I'm going to be demonstrating how to use our site to explore the rankings data. We'll also talk about tools for taking action and take a look at how the Roadmaps to Health Action Center can help you move forward with action and how you can learn from others. Throughout the webinar, we'll head over to countyhealthrankings.org to see how the site functions, so you'll walk away from today's webinar able to confidently navigate our site. We start with our essential question, which is, how can the County Health Rankings and Roadmaps help us build a culture of health? When you look at a quilt, there are many pieces of fabric, different colors and shapes, all interesting in their own right, but when they're stitched together, they serve a common purpose. Similarly, the County Health Rankings and Roadmaps program is made up of many components that work together with a common purpose, to build a culture of health county by county. As we discuss the various components that make up the County Health Rankings and Roadmaps today, think about which piece or pieces of the program you can use. So let's start by reviewing a little about County Health Rankings. The County Health Rankings take several pieces of data and simplify them. They give communities a quick and easy snapshot of their health and of the many factors that impact how well and how long we live. The rankings also serve as a hook, and they generate media coverage. This is good because it helps people understand the health status of their community. It also provides an opportunity for people to tell the story of the many factors affecting health in a community, and to tell the story of the work that's already being done, the efforts that are underway in communities to build a culture of health. The rankings add context. A number by itself doesn't tell us much. The rankings allow communities to compare themselves with others within their state. They can also compare themselves to top U.S. performers on individual measures. And the rankings are a call to action. They provide an opportunity to ignite discussion and action at the local level, with many diverse members of our community coming from multiple sectors together to think about what we can do, what communities can do to improve health. The rankings are, again, a call to action and a starting point for change. The County Health Rankings report is a starting point for discussion in communities. It's definitely not an ending point. Communities will want to dig into their own local data to ask more questions to further understand what's going on in order to know where and how to take action. This slide shows our thinking about how the rankings can be used to improve the health of a community. So we start with population-based data coming to us from a variety of sources. We use that data to rank the health of nearly every county in every state. Each year, the rankings release generates a lot of media attention. So some of you may have read about the rankings or even been quoted in stories in your local media about how your county compares to others in your state. You can use this report to get the word out to your local media and others in your community about the rankings, using it as a call to action. This call to action is intended to help community leaders bring people together from a variety of sectors to look at a community's needs. And then to start to identify which evidence-informed policies and programs they may want to implement locally. As a result, ultimately the health of the community improves. Again, the county health rankings are all about being a call to action. The horizontal portion of the model underpins the rankings. The county health rankings show us that where we live matters to our health, and that a broad range of factors impact how long and how well we live. The vertical portion of the model underpins the roadmaps. The roadmaps offer communities resources to move from awareness to action, to create healthier places to live, learn, work, and play. The County Health Rankings ranks the health of nearly every county in every state. For each county, you will find two rankings, one for health outcomes and one for health factors. We do this because there are two separate sets of messages to convey. How healthy a county currently is, our health outcomes, and how healthy a county might be in the future based on the factors that influence health, our health factors. This is the County Health Rankings model. We point to this image as one of our most important because it outlines what we use to determine the County Health Rankings and what influences health in a community. Because much of what affects our health happens beyond medical care, the rankings underscore how important it is to build a culture of health where getting healthy, staying healthy, and making sure our kids grow up healthy are top priorities. So let's walk through this model. Starting from the very bottom, we believe that effective local, state, and federal policies and programs can improve a variety of factors that in turn shape the health of communities. Many health factors shape our community's health outcomes. We specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes to show how healthy each county is, the length of life and the quality of life. So, thinking through an example, a complete streets policy, a policy that's aimed at improving the way streets are designed to encourage walking and bicycling, can influence health factors such as transit, how people move around the community, how are they commuting to work, and diet and exercise. What kind of opportunities do people have to be physically active in their community? This in turn influences health outcomes. So you can see that policy can influence the health factors, which then in turn impacts how long and how well we live in our communities. So having looked at the model, let's take a look at how our measures are selected. We want communities to take action, so we use measures that reflect aspects of a community that can be improved. The measures that we look to are valid, reliable, and recognized, and often used by other similar national measurements or rankings projects. For example, many of the measures that we use are also used in America's Health Rankings, which annually measures the health of states. Our measures must be available at the county level for every county and every state. The data we use must be available at a low cost or for free, and we want it to be as up-to-date as possible. We use fewer measures. We don't use a whole ton of measures. We have 34 measures that we used in 2014 because the rankings are really meant to be a snapshot. This data is a starting point for communities. We updated our model this year to add housing and transit. We've also updated our measures to help communities better understand their food environment, exercise environment, alcohol use, access to mental health providers, and injury deaths. If you're interested in learning more details about these updates, you can watch our archived webinar describing the new measures, or check out the supplemental handout that went along with that webinar that includes questions and answers and a summary of all of the new measures. Jan is going to be chatting links to that webinar in that handout now, so please check those out if you're interested in digging in and learning more about the new measures for 2014. Those are both really great resources available on our website. So we've taken a look at the model, we've looked at the measures and how we select our measures. We're going to turn our attention now to the website, countyhealthrankings.org. The first segment of our web tour today was going to focus on introducing you to some of the key navigation tips that we have for moving around our site, and we're going to show you a little bit about how to explore the rankings data that we have available. So we're going to go over to the website. You can see this is our homepage at countyhealthrankings.org. And the very first thing I want to call to your attention is the navigation bar up at the top of this page. This navigation bar, this orange navigation bar that we see here, remains at the top of your page throughout the site. It's a really great way to navigate around the full site with just a few clicks. So no matter where you are on the website, you can always scroll up to this navigation bar and to the County Health Rankings and Roadmaps logo to get back to this home page. You can use the rankings menu to access information about our approach, the rankings data and methods, as well as tools to help you understand and use your data. You can also search here to find your state or county. I want to point out that there are several ways that you can get into your county data. This is one of those. So again, you can search right in here for your county or your state. Moving to the right, you can also use the Roadmaps menu to access tools to help you take action and learn from others. Other items that you'll find on this navigation bar include tools and resources. So you can find a variety of tools and resources here, from rankings documentation to Action Center tools to you can actually download a Rankings and Roadmaps presentation that you can use in your own community. You can find upcoming and archived webinars here. You can also check out our County by County blog, search the site, learn more about our program, and find frequently asked questions. So again, this navigation bar stays with you throughout the website, and we'll come back to it ourselves as we continue to tour the site. As you may know, we're celebrating 5 years of County Health Rankings this year, and you can look back at where we've been, read more about what's new this year, and look forward to all that is to come here on our Celebrating 5 Years page. I'm going to click right in on the Learn More orange box on the corner. And this takes us into our Celebrating 5 Years page. A couple of things to note here. The What's New for 2014 section provides a really nice summary of the changes to the model and the Take Action cycle and the improvements to our site. You'll also find our 2014 County Health Rankings Key Findings Report, which includes a summary of key national findings, information on key measures, and new measures, and much more. So that's a really great report to check out if you haven't reviewed that yet. And again, you'll find that on our Celebrating 5 Years page. I'm going to scroll right back up to that navigation bar, and I'm going to hit the County Health Rankings and Roadmaps logo to send me back to our home page. Scrolling down, you'll see this progression of tabs that can help you think about how you can use the countyhealthrankings.org website to explore your rankings data, to move forward with action, and to see and share results. We're going to start with exploring the rankings data. You can get to your rankings data again through the map, or there's also a search box here where you can enter your county or state. As I said, there are several ways that you can get into your county data, and these are two more, using that map or that search bar. And I'm going to actually click right in through the map, and we're going to take a look at New York. This brings us to our state overview page, which shows you both your health outcomes map in green and your health factors map in blue. From this page, you can do a lot of things. We can download data We can find more data from your state-specific data. And down toward the bottom in the center, you can browse more resources for community health improvement from your state, specifically to your state. So some really great links there to state resources. Again, you can look at state data and browse state resources for community health improvement. You can also find stories from your state and a contact on the state overview page. You can also get into the Action Center, which we're going to talk about a little bit more later. So we're not going to click into that yet, but I want you to know that you can move into the Action Center from the state overview page. We're always encouraging users of the countyhealthrankings.org to look at your data and then move to action. So you'll see lots of links into the Action Center. We're going to come back up to these maps, and I'm going to click into Madison County. This takes you to your county snapshot page. You'll notice up at the top here that we've progressed to the second tab up at the top of this page. These tabs offer another way to explore your data. You can use these tabs to explore the measures, to get to download the state, and compare multiple counties within your state. Turning to your county snapshot, you'll find in the first column, you'll find all of our measures. Again, we have 34 measures that make up the county health rankings. All the way to the right on your snapshot, you'll find two overall ranks, a health outcomes rank, which again helps us understand what today's health looks like, and a health factors rank, which helps us think about what tomorrow's health might bring. You'll also find ranks for each health outcome and health factor in this far column. Your county snapshot contains 5 columns of data. The first column, in the first column you'll find your county data. So here's where we see data specific to Madison County, New York. Next, we've included trend graphs for 12 measures where sufficient trend data is available. We've color-coded each icon to help you quickly see whether your county's estimate is increasing, decreasing, or staying the same over time. So the red graph icons indicate that your county is getting worse for this measure. Yellow indicate that your county is staying about the same for the measure, and green indicates that your county is getting better for this measure. So let's take a look at, I'm going to scroll down a little bit here, and let's take a look at the trend graph for adult obesity in Madison County, New York. You'll see your county's trend in orange. You can see your state's trend in green and the national trend in blue. So this is a really helpful addition to the website to help communities get a sense of how they're doing over time on the various measures included in the rankings. In the next column, you'll see the error margin. We use a 95% confidence interval. Basically, this means that we're 95% sure that the actual number for your county is in the given range. In the fourth column, you'll see top U.S. performers. This is the 10th percentile for measures that we are trying to decrease, such as smoking rates, or the 90th percentile for measures where we really want to see an increase, such as high school graduation rates. It's included as an aspirational value. So only 10% of counties in the nation do better than the number given here. And it can give communities something to aim for, something to shoot for. Finally, you'll see your state column. This allows you to compare your county's numbers to your state overall. Areas to explore, which you'll find up here where you can turn those on. Up, you'll find that Areas to Explore button on the right hand, up in the right-hand corner. This highlights potential challenges that a community may want to examine more closely. When you turn this feature on, orange boxes highlight areas to explore based on health factor measures that seem to have the greatest opportunity for improvement. Your county snapshot also includes additional measures. And if we click into these additional measures, we'll find some additional data that can be really helpful to you, but that is not used to calculate the county health rankings. You can learn more about each of the measures included in the county health rankings by clicking on the Measures tab up here on those top tabs, or by clicking on any measure name from the snapshot. So I'm going to click on a measure from the snapshot, and we looked at the adult obesity trend graph. So now let's look a little further at that measure. I'm going to click right into adult obesity on the snapshot. And this brings us to the measure detail page for adult obesity. Once again, you see that we've progressed along the tabs up at the top. And we also have a new set of tabs that are specific to the measure detail page. From these tabs, you can look at detailed data for this measure. You can see the full description, which includes why we use this measure. You can learn about the data source and begin to browse relevant evidence-informed policies and programs from What Works for Health. To the left, you'll see a brief description of the measure, a little bit about the rankings methodology, including the years of data used, and summary information for this measure. You can navigate to other measures from this page as well, using the orange box in the top left-hand corner. So I'm going to go back up and pull up that navigational bar. I want to point out that we've also included some tools on our site to help you understand your rankings data and to think about how you can measure your community's progress over time. You can use the rankings menu to get to using the rankings data, which helps you understand what your rankings data tells you and to go beyond that rankings data. And then measuring progress. We're going to click into measuring progress here. This is a new tool that helps you understand how to use the rankings measures, where to look for other data that can help tell your community's story, and how to tell if your community is poised for progress. You can learn more about this tool in our upcoming April 22nd webinar. And Jan has just posted a link where you can register for that webinar if you're interested in learning more about how you can measure progress in your communities. So as you can see, countyhealthrankings.org offers a number of ways to explore your county's data as a starting point for change. So this brings us to the roadmaps, which offer communities resources to move from awareness to action. So let's go back to the slides and learn a little bit more about roadmaps. Okay. So we're going to take a look again at that model for change that we use in the County Health Rankings and Roadmaps program. The roadmaps fulfills that vertical section. Now that we have our community's attention, we want to find the best possible strategies to impact our community's health priorities. This is where communities take action to improve health. But how do we do this? The Take Action cycle is the how within County Health Rankings and Roadmaps. At its core are people working together to improve health in a community, because we know that solving issues like low income populations, children in poverty, low high school graduation rates, excessive drinking, or poor health care requires the wisdom and resources of people from all walks of life. So you'll see several sectors in the blue circles in the center of the Take Action cycle. Communities can improve health by using the steps of the cycle, assessing needs and resources, focusing on what's important, choosing effective policies and programs, acting on what's important, and being sure to evaluate those actions. Throughout this work, it's important to continually communicate with partners, policymakers, and your community, and to know how to use the media to effectively tell your story. The roadmaps offers communities resources to move from awareness to action, and there are 5 core principles that are the foundation of roadmaps. First, it takes everyone, all of us working together to improve the health of a community. We need to move as quickly as possible to the left side of that take action cycle, to not get stuck in paralysis by analysis or drowning in data, but we want to move to action and evaluate our effectiveness. We don't need to reinvent the wheel, and we should be looking to the evidence to inform our action. And when we do innovate, we want to be sure to evaluate. We also want to focus across health factors, including those social and economic factors as important factors that really play a big role in how long and how well we live in our communities. And not be afraid to take on policy, systems, and environmental changes that will, in the long run, create the greatest long-term change in health for the children and adults in our communities. The Take Action cycle lays out a series of steps that communities take to work together to build a culture of health. But this series of steps isn't always as clear and as simple as they appear in this graphic, right? This work is complicated and it can be messy. Building relationships across sectors can be challenging. So we've designed a series of guides to help communities take the next step, wherever they might be in the Take Action cycle. We're going to go back now to countyhealthrankings.org, and we're going to take a look at the roadmaps and the tools that we can use there to help us take action. The second segment of our website tour will focus on tools for taking action and learning from others. So we come back to County Health Rankings website, and we're going to continue to use this navigation bar. We're going to use that to go into the roadmaps, into the Action Center. All right. And just as a reminder, we can get to the roadmaps menu in a couple of different ways, to the Action Center in a couple of different ways. We can use the roadmaps menu as we just did, or we could have gone back to the home page using that County Health Rankings and Roadmaps logo and using the tabs at the center of the home page to get to the Action Center. So the County Health Rankings and Roadmaps program includes the Roadmaps to Health Action Center, which has guides for each step in the Take Action cycle. The guides describe the key activities within each step and provide suggested tools, resources, and additional reading. You can start at Assess on the Take Action cycle or enter at any step, really. Work together and communicate sit inside because they are needed throughout the cycle. So this is an interactive page, and you can hover your mouse over each step in the Take Action cycle. So you can see here we're hovering over Assess Needs and Resources. This brings, you see at the center of the cycle now we have a couple of questions that can help us understand what this guide offers, the questions that will be answered in the guide. This allows you to understand the different steps before actually diving into the guides. There's also a guide for each of the different types of people in the blue bubbles. These guides provide information on the role that each sector can play in improving the health of communities, along with guidance on what they can do during each step in the Take Action cycle. So let's take a look at one of these guides. I'm going to click on Work Together. Here you'll find a brief description of the action step, the purpose, and who to involve. You'll find some highlighted tools and materials on the right-hand side here, and the option to download the guide as a PDF. Scrolling down, you'll see that we've broken each step into key activities. So you can find the most relevant guidance and tools for where you are in this step. When you find a key activity that is of interest, you can open it. So I'm going to click on this Recruit and Involve Diverse Stakeholders key activity. You can open it to read the guidance and explore the links to related tools. New this year, you'll also find community spotlights scattered throughout the Action Center and What Works for Health. These community spotlights provide examples of programs, policies, and tools in action. So here we can see that we have an example of a community spotlight from the United Way of Greater Toledo that explains how they used, I'm going to click into it quickly, that explains how they used 3 of the tools included in this key activity. You'll see that this is a fairly short spotlight. These aren't intended to be very long. They're really intended to be quick examples that focus on the nuts and bolts of how work is done, key partners, and accomplishments. I'm going to hit the back arrow on my browser to move back to Work Together. Throughout the site, you'll find these boxes that you see to the right here, inviting you to contact our team for personalized free help. Clicking on Get Help will take you to an email form that will then get to one of our 4 community coaches who, thanks to support from the Robert Wood Johnson Foundation, can be in touch with you to help you think about what your next step is or which tools might help. So this is a great way to get connected with us. Another key tool that you'll find in roadmaps is What Works for Health. So we're going to, again, go right back up to that navigation bar and look at the Roadmaps menu and click into What Works for Health. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and systems changes that will improve the variety of factors that we know affect health. To learn more about strategies that could work in your community, you can select a health factor of interest using these light blue boxes on the model, or enter a keyword into the search box. A new feature in What Works for Health this year is that you can now browse new policies and programs that have been recently added to What Works for Health. You'll notice on the right side of your screen here, there are new policies and programs listed here. What Works for Health is a growing and changing resource, and we're always looking for new strategies to include. So if you are looking for a strategy that you're not finding in What Works for Health, contact us using that Get Help box. Shoot us an email. Let us know what you're looking for. And the team who works on What Works for Health can start to look into those strategies. Again, we're always looking for new strategies to add to What Works for Health. So that's a great way to let us know what you're looking for. So on the model, I'm going to click into Income. And we'll take a look at the types of policies and programs that we can find here. We see 13 results come up under Income. And from here, you can use the left navigation bar to further filter the options that or the policies and programs that you're looking at. You can filter by health factor, if there are more than one health factor that is impacted by the strategies listed here. You can filter by approach. So you can see that Income includes 2 different approaches: increase or supplement income, and support asset development. You can also further filter by decision makers and evidence ratings. The 13 results that we see here are those with the highest rating appear first. So those rated scientifically supported appear first in our list of 13 results. Evidence of effectiveness can mean different things to different people. So our approach to assessing evidence combines what we know from scientific study and the observations of unbiased experts. Each reviewed strategy is assigned an evidence rating based on the quantity, quality, and findings of relevant research. And if you click on a strategy, and we're going to go ahead and click on Increase the Earned Income Tax Credit, you'll find the full entry for that policy or program, which includes expected beneficial outcomes, evidence of effectiveness, the impact on disparities, and implementation examples and resources when we have them available. This strategy also includes a community spotlight, which you'll see on the left side here, which highlights how Kentucky Youth Advocates is working on a statewide earned income tax credit. So again, we're using these community spotlights as a way to show an example of how communities are actually putting the strategies and what works for health and the activities and the tools in the Action Center into action in their community. If you hover over the thermometer, the rating thermometer up in the top left there, you can see our definitions for all 6 ratings. We're going to go back to the main What Works for Health homepage. And I want to point out that you can learn more about our ratings and our methods using the left navigation menu on the main What Works for Health page, where you'll see tips for using What Works for Health, more information about our ratings, our methods, our sources, and then tips for choosing your strategy. So there's great options there to dig into that resource even further.